everybody, this is Dr. Brett Talley, Daniel, MD, neurologist and headache doctor, and today I'm speaking on the subject of, do Timolol eye drops work for acute migraine therapy? And I'm going to refer to the drug all through the talk as Timolol. All persons with migraine need to adjust their lives to live with such a chronic disease. It's not their fault they have it. Migraine is genetic and clusters in families. 20% of persons with chronic migraine are disabled. Migraine is a frequent reason for missing school or work. It's a common reason to go to the emergency room. The most successful acute treatment for a migraine attack is 6 milligrams subcutaneous sumatriptan, which acts within 10 minutes but requires an injection with a needle. A class of drugs called triptans are the best treatment for acute therapy, and there are 7 triptans. The pills, which are generic now, take about 30 minutes to work, and the nasal sprays work in 10 minutes but give low drug levels. The incidence of chronic migraine in the world is 3 to 4%, and 90% of chronic migraine patients have medication-overuse headache. Medication-overuse headache is 80 to 90% of new patients in a headache clinic. Commonly used headache therapy for migraine involves NSAID, so it's a mnemonic, this means non-steroidal anti-inflammatory drugs, and those are drugs like Aleve or Advil, caffeine drugs like Excedrin, and doctor prescription drugs like triptans. Narcotics like hydrocodone or barbiturates like butalbital are class 4 narcotics and have no place in the acute therapy of migraine because they cause medication-overuse headache. Dihydroergotamine, known as DHE, can be used IV in hospital or intramuscularly or as a nasal spray under doctor's prescription as an outpatient. DHE is helpful but will not cause medication-overuse headache. Therefore, with all these problems, many migraineurs are left with their chronic headaches and limited therapeutic choices. However, many migraine patients find quick relief with Timolol, a beta blocker eye drop. So the question is, do Timolol eye drops work for acute migraine therapy? Timolol works well for acute migraine therapy. It doesn't cause or aggravate medication-overuse headache. Although the FDA indication for the drug is to treat glaucoma, Timolol works well for acute migraine therapy. What is the dose of Timolol? The dose for treating headache is 0.25 or 0.5% solution as 1 to 2 drops in both eyes at onset, which may be repeated every 1 to 2 hours, and there's no adjusting for renal impairment. Well, aren't beta blockers like propranolol or atenolol used for migraine prevention? Yes, both those drugs are oral pill medications that have a long history of use for migraine prevention. They don't work for acute therapy of migraine. What are the side effects of using Timolol? Those are hypersensitivity to drug or class, asthma, bronchial, COPD, severe, heart failure, uncompensated, second or third degree AV block, sinus bradycardia, cardiogenic shock, and one should caution if bronchospastic disease, major surgery, diabetes mellitus, hyperthyroidism, myasthenia gravis, glaucoma, angle closure, anaphylactic reaction or history of that. What are the drug reactions? Well, CYP2D6 substrate, bradycardia, or hypotensive effects. Safety and monitoring. No routine tests are recommended. Pregnancy may use during pregnancy. Lactation may use during breastfeeding. Pharmacology. The drug is a non-selective beta-1, beta-2 adrenergic receptor. It antagonizes those drugs. Literature articles. I've got an article here by Miguelazzo and Hagen, writing in Missouri Medicine in 2004. Their take-home message was, a small case series of patients has shown that beta blocker drugs may be a simple and inexpensive way to eliminate pain in patients with acute migraine. Millions of patients suffer from migraines, and their physicians historically have gone through Herculean efforts to find pain relief, but interestingly, an inexpensive and effective drug may be literally sitting on the shelf and waiting to be tested in clinical trials. Beta blocker eye drops, when used to treat glaucoma, have been shown in a series of patients to provide almost complete pain relief from acute migraine over years of use at very low cost to the patient. Miglazio is an ophthalmologist in private practice, and he's been focused on investigation into the usefulness of this therapy for acute migraine for decades. Dr. Hagen is in private practice, and he recently joined the other doctor in his effort. Both investigators know that while daily oral beta blockers such as Timolol, Bexacolol, Lobutol, Metoprolol, Carbiturol have been used routinely to prevent chronic migraines, the drugs do not stop acute onset migraines after the onset of symptoms. The mechanism of action of the drops, the authors believe, is the passage of the beta blockers into the nasal cavity and the rapid absorption into the blood vessels. Within a few minutes, the blood level of the beta blocker is increased sufficiently to stop the escalating migraine headache, Dr. Hagen said. This action would explain the success of the beta blocking eye drops and the failure of oral medications, as delivery through the eyes is much quicker than through the GI system. In some of their most recent work, published in the 2014 issue of Missouri Medicine, the investigator evaluated the effects of Timolol 0.25 and 0.5% in 7 women who used the eye drops when they first experienced migraine symptoms. According to Dr. Hagen, the women used these treatments over years, and the patients reported nearly complete pain relief and few adverse effects. They had 2 case reports. A 38-year-old woman who had migraines for 25 years. Her acute episodes were characterized by right-sided headache, nausea, vomiting, light and sound sensitivity, and confusion. Untreated migrainous episodes lasted 24 hours or longer. Relief sought with severe oral treatments brought symptom relief after several hours. She began instilling 1 drop of topical Timolol, 0.25 milligram percent, ophthalmic solution in both eyes with the first migraine symptoms, with symptom relief after 10 to 20 minutes. On a scale of 1 to 10, the patient rated her relief as 8. She reported slight shortness of breath with bilateral solution, but now just uses 1 drop in 1 eye with no adverse effects. A 57-year-old woman who began having migraines at age 5 complained of visual aura, unilateral headache, nausea, vomiting, photophobia, and confusion as her typical symptoms. Her migrainous episodes began with a visual aura lasting 10 to 20 minutes, following by severe pain above the right eye. The migraines usually lasted 4 to 6 hours, following by a feeling of a hangover for 1 to 2 days. About 27 years ago, she started using Timolol 0.5% ophthalmic solution sublingually when the aura began. Improvement began in about 10 minutes, and in 30 to 45 minutes, the symptoms were completely relieved. She also had asthma, but use of Timolol did not cause breathing problems. In her mid to late 40s, she was able to discontinue use of Timolol when the migraine stopped. The investigator noted that not all patients with migraines are candidates for this treatment if they have asthma, other breathing problems, and some eye problems. The authors also stressed that these patients taking beta blocker eye drops for acute migraine attacks be monitored closely. Dr. Hagen noted that while this study had only 7 patients, if the results could be replicated in larger placebo-controlled studies, this treatment approach could be beneficial worldwide. Roadblocks. Dr. Hagen emphasized that beta blockers have been reported to successfully eliminate the pain of migraine over the last 35 years. The first reports appeared in 1980 and were followed by others, but to date, no large clinical trials have been conducted. Dr. Hagen blames this on the fact that the drugs are available generically, which will provide little profit for the pharmaceutical industry to explore this treatment. He emphasized that prospective, masked, controlled, randomized clinical trials are long overdue, and they could prove or disprove whether beta blocker drops are useful for treating acute, even chronic migraines. Okay, the next article is by Dr. Cody, Dexter, and Katie. They're from the Headache Care Center in Springfield, Missouri. They wrote with the title of Use of Beta Blocker Ophthalmic Solution for Treatment of Migraine. In the Annals of Migraine, one of the most fascinating stories is how in 1966, a physician named Robert Rabkin observed that the drug propranolol could prevent migraine. Dr. Rabkin was actually conducting a study using a beta blocker, propranolol, to treat heart pain, which is angina, and fortuitously observed that one of his research subjects had a remarkable reduction in the frequency of his migraine attacks. A decade later, Dr. Seymour Diamond and John Graham presented their experience treating 86 migraine patients with daily propranolol to the Food and Drug Administration and demonstrated that propranolol was indeed efficacious and safe for migraine prophylactic therapy. Subsequently, propranolol became the first FDA-approved medication for the prevention of migraine. As one of the many beta blockers used commonly to prevent migraine, propranolol currently is probably the most widely prescribed medicine in the world for prevention of migraine. Beta blockers are used to treat multiple diseases, including high blood pressure, heart pain, and irregularities of the heart, as well as conditions such as anxiety and certain types of tremors. Beta blockers have been so successful that they're considered one of the most important medical discoveries of the 20th century. In 1978, a second beta blocker, Timolol, also received FDA approval as the first topical beta blocker for the treatment of glaucoma, although clinical trials demonstrated a very strong benefit from using Timolol as a migraine preventive. Neither it nor propranolol have demonstrated efficacy as an acute treatment for migraine. However, these previous studies have focused on oral preparation of these drugs. The drug was not absorbed quickly enough to be effective as an acute treatment. Interestingly, since the 1980s, there have been rare case reports of patients with glaucoma being treated with Timolol who experienced migraine relief. Considering the history of these beta blockers, two ophthalmologists, John Hagen and Migliazzo, recently made a startling observation during a game of golf. These ophthalmologists had a eureka moment. These are the guys in the first article I discussed, while discussing possible treatment options for Dr. Hagen's daughters who experienced migraine. They observed that some of their patients treated for glaucoma with Timolol eye drops reported that if the Timolol eye drops were instilled during a migraine, the headache would be rapidly terminated. Following their discussion of the use of beta blocker eye drops for the treatment of acute migraine, Drs. Hagen and Migliazzo reported on a series of 7 patients who had successfully treated acute attacks of migraine. All right, how would beta blockers work in the acute treatment of migraine? The exact mechanism of beta blockers treatment of prevention of migraine is unknown. They work primarily by blocking or stimulating or activating the effects of adrenaline. Considering that individuals with migraine have inherited a nervous system that's more excitable than those without migraine, it's easy to assume that beta blockers may in some way reduce its inherent excitability. In other words, the beta blockers may make the nervous system less vulnerable to migraine. While this likely explains the migraine prevention benefits, it may also provide a rationale for the use in the acute therapy of migraine headaches. One can imagine that during a migraine, the threshold for nervous system activation has already been surpassed, and hence the process of migraine occurs. Beta blocker eye drops enter the nasal cavity through the lacrimal duct, which is a small passageway from the eye to the nose that drains tears from the eye very quickly. Once in the nose, the eye drops are rapidly absorbed into the blood. Conceivably, they could block the activating effects of adrenaline and allow the nervous system to reverse migraine. Beyond the speed of entry into the blood, another major advantage of nasal absorption is that medications do not have to pass through the liver before entering the systemic circulation, thus avoiding their metabolism by the liver and allowing a much smaller dose of medication to be effective. Beta blockers have also been found to reduce the electrical excitability of nerve cells, and this too may be a part of their potential mechanism. When oral preparations of beta blockers are used to prevent migraine, levels build up slowly in the blood, and this action works well for prevention, but during migraine, these levels would increase too slowly to be effective during an attack. Using an eye drop with rapid absorption to the nose circumvents this problem. Also, nerves in the nasal cavity may become activated. Potentially, beta blockers could act directly on these nerves. Finally, it's possible that some of the beta blocker eye drop could be absorbed into the brain and exert their beneficial effect in that manner. Would beta blocker eye drops be a breakthrough for the acute treatment of migraine? Currently, medications used to treat acute migraine generally are either triptans or NSAIDs. Triptans act by constricting blood vessels and blocking the release of CGRP from the nerves activated during migraine. CGRP causes blood vessels to swell and initiates a cascade of inflammatory events leading to pain. The NSAIDs are believed to work primarily by blocking the synthesis of another inflammatory pathway mediated by prostaglandins. If beta blockers fail to be an effective acute treatment for migraine, their efficacy would likely be due to novel mechanisms and provide a third line of potential treatment success. This finding would undoubtedly represent a major medical advancement in the acute treatment of migraine. Also, because beta blockers are already used on a daily basis to prevent migraine, it's likely their frequent use to treat acute migraine would be associated with medication overuse headache, but that doesn't occur. This finding would be welcome news to those individuals with high treatment requirements. The beta blocker eye drops would also likely have a good stability and a good tolerability profile, as the dose of medicine received would be relatively low. So, this is the end of my dictation on this report on do Timoptic or Timolol eye drops work for acute migraine treatment. I myself have used it in this office for years. They work really well for a lot of folks. Please click subscribe down there so we can follow each other. And check into Podbean for other talks I have on migraine headache there. And I will see you on the next talk.